So what is a complex generic? I showed it on an earlier slide. Of the $350 billion of opportunity, about $100 billion of that is complex generics. It's basically the marrying of a medicine with a delivery system. Whether that's a patch, whether that's an auto-injector, or as we think to the future, whether that's just a computer chip that has medicines built into it that dispenses, when you need it. As we look to the future, there's going to be still the opportunity for pills in capsules, or as we call them, little white pills in our shop. About a third of the opportunity is still in little white pills. But 2/3 of the opportunity is in new delivery systems. And the regulator hasn't quite caught up with how do you test for that? What will that be named? What will you be allowed to name that? Will, when you go into a pharmacy and you give a prescription for an EpiPen, will you be allowed to walk out with Teva's epinephrine auto-injector or not? That hasn't been worked out yet. We don't know the answers to those yet. So these fundamental questions about where the industry is going and where the regulator hasn't quite caught up takes an awful lot of time relative to naming interchangeability, but we must work through that in order to succeed, to continue to bring another $1 trillion of savings to the healthcare system as we look to the future. The regulatory environment is continuing to change. For this one, I'm actually ever so grateful for that. Ever since I came back to North America, having experienced the rest of the world, I realized how high the quality standards are in North America in comparison to other parts of the world where the government does regulate, but doesn't regulate necessarily up to the same standards as the FDA or the equivalent here in Canada. And I've been arguing for the last 2 years that the FDA must raise its standards as it looks to medicines produced outside of Canada and U.S., of those medicines coming into Canada and the U.S. And I've taken a lot of arrows from my competitors on this, many of them who make products outside of the U.S. But I've stood firm and had this argument because I was there. I was in those plants. I was responsible for those businesses. I saw what was going on, and I saw the potential of a very negative public relations effect happening here in North America if those standards didn't get harmonized.